then I think it's something that could be considered along with adjunctive medical therapy. But you do need to be aware there are actually no long-term data outcome in this group. So nobody's actually published their series of primary endoscopically managed patients with polyposis. So moving track onto the hematomatous syndromes, of which probably the best defined is the Polyp syndrome, beloved of medical students because it's rare and has great pictures. So it's rare, about 1 in 100,000. We know the underlying genetic diagnosis, so genetic testing is available. And the hallmarks of it is typified by the mucocutaneous pigmentation as demonstrated on the left, and intestinal polyposis. So it is associated with increased risk of a whole number of cancers, and there's some good literature, and that's very well established. But specifically, there is a high risk of colorectal cancer. Interestingly, the more recent data hasn't actually come out as showing colorectal cancer as being a major problem. Pancreatic and breast cancer seem to be the top two currently. So what is the PGS polyp? Well, shown here on your right, they're usually pedunculated polyps, and they're described as hematomas. They can be seen throughout the GI tract, so they definitely involve the colon, but the small bowel is affected more commonly. They can actually be seen outside the GI tract as well. And the reason why they are problematic mostly is because they cause polyp-related complications, so bleeding and symptomatic anemia. Are they pre-malignant is an area of great debate. There's no clear data to say one way or t'other. And if you look in the recent literature, there are definite proponents who say, well, we've had cancers arising in a PGS polyp. And there are other people who say, well, actually, these are polyclonal polyps. They can't possibly be pre-malignant. And when cancer does arise, it's just purely by chance, and the whole of the intestinal mucosa is in flux and in an unstable condition. So what's the role of colonoscopy in Polyp syndrome? Well, specifically, really, to prevent polyp-related complications, the anemia and the bleeding. To detect early colorectal cancer, I think is very reasonable. Can it prevent? Well, I said that there's some data recently. I'm not always big up in myself, but most of the literature here is very sparse, and so I have written a couple of series, so I'll plug them. So the data from St Mark shows that in actual fact we only had one colorectal cancer in all our cohort, which is a quarter of that which should be expected if you look at old historical figures, with the same number of breast cancers and pancreatic cancers as being predicted by old historical numbers. So does that mean by our regular surveillance we're preventing cancer? I don't know, but in our cohort we had a quarter of what we would expect. Our current practice is to initiate at the age of 8.